So without further ado, let's get into the overview of the most common method by which the majority of our patients sustain their injuries and their problems, and that is a rear end automobile collision. So an overview of a common rear end automobile collision and the occupant vector biomechanics causing ligament injury. So I'm going to show you a model of a simple rear end automobile collision and what happens to an occupant when rear-ended. So at the initial onset of impact, and I'm going to take into account here that this patient is not guarding for the impact. So this is where the majority of the significant ligament injuries occur, when there's no guarding. Contrary to what often people believe in the public, is that guarding is a bad thing. Guarding is probably one of the best things you can do when you're exposed or predisposed to one of these collisions. But for this example, let's go on the notion that they're not expecting this to happen. So at the point of impact, the car seat starts to move forward. The occupant remains stationary due to the inertia, and there are no occupant forces. So as the collision progresses, at 100 milliseconds, the car seat gets pushed into the back of the occupant's torso, pushing their body forward, but their head remains stationary still. And so relative connection between their head and their body, or their head and their neck, you get shearing forces where the cranium is being forced posteriorly as the body's being pushed forward. So you have a shearing or a planar motion like this initially happening at that moment in time. And these shearing forces are focused and accentuated at the craniovertebral junction. The next component here is at 175 milliseconds, where the shearing turns into an extension or a backwards tilting with shearing and distractive or traction forces on the head as it relates to the neck, as the car seat and torso are being accelerated further forward. And then if we fast forward to the recoil moment of that, so when the body is shot forward as the car comes to a stop and the occupant potentially slams on the brake to slow this process down, they're shot forward as the car comes to a slowdown or a stop. And so then their head and torso are accelerated forward, resulting in a flexion of the spine, particularly the cervical spine, and then the head fulcruming into flexion and also being distracted. And the accentuation of this generally happens when the seatbelt tensioner goes off and the seatbelt stops this motion. And so you have the momentum pushing forward, and then the seatbelt stops that, which will put a distractive force on the craniovertebral junction, predisposing that area for ligamentous compromise. This is just a simple schematic showing the same thing. So initially, you can see on the left image that there's the cervical lordosis is maintained. And then as soon as the acceleration of the vehicle and the seat and the torso starts to happen, there's a straightening of the cervical lordosis, which is, I would humbly suggest, is one of the most significant findings when we see normal röntgenograms or x-rays of these patients when they have a straightened lordosis or reverse lordosis. That is a red flag to look further. And then this is the moment where the shearing happens in the uniplanar motion like this. And then the next image shows the extension. So cervical lordosis is accentuated. The head rocks rearward or extends on top of the cervical spine with distractive forces on the head relative to the fixated body. And then upon the recoil, we have then a reversal of the lordosis with traction being put onto the skull axially upward and forward. So potential chance to injure the deep ligaments of the craniovertebral junction centrally anterior and centrally posterior of center in both of those scenarios.